Good morning, everyone. Good afternoon, good evening, wherever you are. It's a great honor for me to introduce the GRN Soufan Center panel, which has become a tradition in the Global Security Forum, where CTED, those of you who are not familiar with us, is the counter-terrorism body charged with promoting and assessing a member states' implementation of Security Council resolutions related to counter-terrorism, and the Soufan Center, the host of this event, are joining forces to bring perspectives from around the world. And we are extremely thankful to the Soufan Center for giving us the platform and the opportunity to collaborate. And we're doing so through one of CTED's most valuable tools, the GRN, the Global Research Network. The Global Research Network was founded some 5 years ago, and it's a force multiplier for CTED work, allowing it to get access to the best and brightest minds around the world. And I will immediately hand over to Dave Wells, who coordinates our cooperation with the Global Research Network, to say a few words about the network, perhaps invite few of you who wish to join before we actually start the conversation. So Dave, over to you.
Thank you, David. And yeah, I'll keep this very brief as I'm really keen to hear from the great panel that we've got lined up this morning. So as David said, I coordinate CTED's engagement with academia globally. The Soufan Center, as David says, has been a really great and long-standing member of our global research network. But as we've already heard, we're always keen to hear from researchers around the world who have different perspectives to offer on CTED's increasingly broad counter-terrorism mandate. The GRN, there's a few different things for CTED. Firstly, CTED's key role, one of CTED's key roles is our mandate on trends, issues, and developments. And key to that really is hearing the perspectives of the global research community. It happens in a number of different ways, either directly, briefing the Counter-Terrorism Committee and the Security Council itself, within CTED's broad range of different publications where we try and integrate research wherever we can and wherever relevant, but also collaborative events like today's event with the Soufan Center. It's really vital, we think, that policymakers get access to the greatest and broadest possible evidence base when they're making policy, and we see the Global Research Network and the research community more broadly as central to that mission. So all it leaves for me to be said is, again, really delighted to be collaborating with the Soufan Center on this event. I'm really pleased to have such a diverse panel of researchers from all around the world for you to listen to this morning. Thank you.
Thank you, Dave. And we'll immediately kick off. As Dave mentioned, one of the advantages of the GRN is that it's truly global. And we have today a wonderful group of researchers from different parts of the world and that will share with us what they're seeing in the terrorism scene. And I will immediately move to our first panelist, Raffaello Pantucci. Raffaello is a senior fellow at the International Center of Police Violence and Terrorism Research at Nanyang Technological University, Singapore. He's also a senior associate fellow at RUSI, another member of the Global Research Network, Britain Suburban Terrorists. Raffaello, thank you very much for being with us. I saw that in the last few months you've written extensively on the impact of COVID-19 on recruitment, on the sentiment among young people, and we really would like to hear what you're seeing and what would you like to share with us. Over to you, Raffaello.
Well, thank you very much, David, and let me also extend my thanks to the Soufan Center and to GRN for the kind invitation to join you on this panel. David, I heard you kick it off with a good morning. Well, in Singapore, it's good evening. So good evening to colleagues out there who are in Asia, like myself. So I'll keep my comments very brief. I mean, the question of COVID and its impact on counterterrorism and counter-violent extremism is still a very dynamic subject and very open, partially because COVID, of course, isn't behind us. So it's quite difficult in some ways to evaluate exactly what the impact is of COVID on counterterrorism and CVE, because we're still in the middle of dealing with it. So until we really know when we're kind of past it and can see it in the back end, you know, notwithstanding this wonderful news we've had about vaccines recently, it's difficult to be able to make clean evaluations about exactly what the impact has been. Having said that, I think in some of the research I've been trying to do over the past year as COVID's been unfolding, and as we've all been locked down at home trying to figure out how to do research remotely, there are a few trends I would argue that we've started to pick up. I think one of the main things I would point to is something that is broadly talked about with COVID in general, which is that COVID's been an incredible accelerant on trends that had already been ongoing. And I think when we look within the sort of CT and CVE space, I would argue that's the case there as well. So whereas the trend had generally been towards a greater level of online radicalization having an impact, whereby you were seeing growing numbers of cases of young individuals who were radicalizing really almost entirely online. There was some contact sometimes, and often it required them getting towards networks if they wanted to, travel to a battle zone or something like that. But you were seeing growing numbers of cases where you had individuals who were essentially going all the way through the process of radicalization with very limited contact offline with other people in the world in the radical milieu. And that trend, of course, has been wildly exacerbated by COVID, with vast numbers of people being locked down, being stuck at home, being unable to sort of get out of, into the ordinary world and do things. And that's meant, individuals who are sort of prone to trying to dig into conspiracy theories or understanding the world through what they see online, we increasingly see an acceleration of that. And if we think of the QAnon phenomenon, for example, this almost entirely online sort of phenomenon, which has even produced individuals who radicalize all the way to commit terrorist acts, a moment when vast numbers of population are spending huge amounts of time online is a perfect moment for a theory like that or a conspiracy theory like that to really take off. So I think we can say that COVID has exacerbated and accelerated a trend that I would argue was already going on as well. I think another question which we still have to see the full impact of is what is going to be the impact of COVID on exacerbating inequalities within communities and around the world. Now, as we know, these sorts of inequalities are often at the fundament of why people are sort of interested in joining extremist groups in the first place and why they're attracted to extremist ideologies. And clearly during COVID, we're going to see an increase of these inequalities. And this will express itself at a global level, it'll express itself at a national level, it'll even probably express itself within communities. And I think that will be a real question to keep an eye on as we go forwards to see exactly how much and where these inequalities are getting sharpened, and therefore how groups and ideologies might take advantage of that going forwards. Looking at the sort of more practical and tangible end of the scale, I think we've already started to see a tightening of budgets. We've seen a tightening of security budgets happening already. This was something that was happening before COVID as well, as you saw the world shifting, in particular in the West, to focusing more on great power competition and looking at sort of great state threats rather than thinking so much of counterterrorism as the sort of preeminent security threat the countries look at. And this means a reduction, frankly, in security budgets towards dealing with CT threats and in terms of dealing with CVE threats. And CVE threats and tracking exactly how much shrinkage we're seeing there is going to be very difficult because, of course, CVE threats are ones that you really try to handle upstream. And so the budgets allocated towards that are often quite difficult to sort of specifically understand. And so I think the shrinking budgets is going to have a practical impact on COVID going forwards, is going to have an impact on our response to dealing with these problems going forwards. And I think managing that and keeping an eye on that particular problem is something that we're going to have to keep an eye on. And then the final point I'll briefly make in my sort of opening remarks is some of the quirks in practical counterterrorism impact that we've seen as a result of COVID and the lockdowns often that we've seen. I think one of the first issues we've seen is security forces. On the one hand, we've seen reports that security forces have said actually they see a diminished threat because the terrorist groups that they're looking at, the networks they're focused on are unable to move about. They're unable to do a lot of the activity that they would ordinarily. That makes it kind of easier for security forces. Funding flows in parts of Southeast Asia have been disrupted as a result of COVID. Criminal activity that terrorists used to do to raise money to then go conduct attacks has been stopped because you can't do criminal activity because no one's going outside anymore. So there is a sort of practical question. But then on the other side, security forces are also reporting that it's becoming harder for them to trail people. With less people wandering around, this makes it harder for your security agents to hide in a crowd and follow individuals they're interested in. So we've seen some sort of practical quirks at the other end of the threat as well. But I think the key thing I leave with my opening remarks is that we're still at a very early stage of trying to understand this and be able to make a very direct causal link at this stage when we're still in the middle of dealing with COVID is maybe a bit premature, but I think we can definitely see some trends starting to map themselves out. Maybe, David, I'll leave it at that and I'll pass it back to you to pass it on to whoever's next on the panel. Thank you.
Thank you very much, Raffaello. This has been a great start for this panel. I really liked what you said about COVID as accelerator, and I still remember an interview that I think it was the CEO of Microsoft who, when he spoke about the impact of COVID-19 on our digital life, he said processes that we were expecting to happen in 10 years have been condensed into 3 months. And I think we're seeing basically the same in the terrorism scene, that processes that may have happened in the framework of 5 to 10 years have been completely condensed. I think I know you wrote about the fact that we are now actually seeing lone wolves. It's not just a theoretical concept. We're actually seeing now people that all the terrorism cycle from being exposed to radicalization to perpetrating the happens online completely for law enforcement, for security services, and we will hopefully get back to that. We're going to immediately jump from Singapore and Southeast Asia all the way to Africa, and thank you very much, Ornella, for joining us. Ornella is the head of the Sahel program at the ISS, the Institute for Security Studies, again, a long-standing partner of CTED. She has extensive experience working on peace building, security sector governance, and democratic processes in West Africa, including with UNDP and African Union. Ornella, we're talking a lot about COVID-19, and I don't think we're talking enough not on the impact of COVID-19 on Africa, and more relevant to this conversation, the impact of COVID-19 on the terrorism landscape in Africa. So we're really thankful to you for joining us, and we're really excited to hear your own thoughts on how COVID-19 impact the terrorism threat. We know that this is a heightened political environment in Africa these days. And it will be very, very interesting to hear that perspective. So thank you again for joining us, Ornella.
Thanks very much, David. So it's my pleasure to join. And in fact, the question you raised, I think, is a very interesting one. The first thing I would say about COVID-19 in Africa, and I will maybe focus on the Sahel region where I work and which I know best, so Central Sahel as Mali, Niger, Burkina Faso, and neighboring countries, which is also the heart of a complex security and humanitarian crisis that involves violent extremism. So the first thing I would say about COVID in this region is that it definitely has not led to the health catastrophe that was announced. At the beginning of the pandemic, there was a lot of concern that because of the weakness of health systems in Africa, and especially in the Sahel, which contains a number of the poorest countries in the world, this could be a major disaster. This disaster in terms of numbers of cases or fatalities due to COVID did not happen. What we did see happen, on the other hand, is a very high toll in terms of socio-economic impact of the COVID. So Raffaello was mentioning this increase of inequalities due to COVID. This is definitely something we are seeing in this region, with an additional 6 million people pushed into extreme poverty just this year due to COVID-related measures. And when I say COVID-related measures, I mean the limitations of on citizens' freedoms, on mobility, on economic activity, border closures, and things like that, that had a very strong impact on reducing economic activity. So, of course, in an environment that's already highly affected by conflict, by inequalities, by corruption, and by a number of other governance, this creates additional risks. That being said, we also didn't see an increase in violence directly due to the COVID. The question we should be asking ourselves, I think, is whether in the medium to long term, this situation, this COVID situation and the socio-economic impact it's having is not creating more of a fertile ground for violent extremist groups. And this, I think, is a major concern. On the other hand, looking at the counter-terrorism aspect of things, we have on the ground a number of forces in the Sahel. Some analysts have even called this the traffic jam of security actors, with a UN mission, French troops deployed, a number of European troops deployed, Sahel troops deployed themselves, Sahel troops deployed each on their side and together within what they call the G5 Sahel Joint Force, and a number of other actors. So there is a lot of boots on the ground, but violence against civilians remains extremely high. In fact, it's been higher this year, even just in the first 8 months of this year, January to August, than in any full year in the previous 10 years. So we do see an increase in conflictuality that can't be directly linked to COVID, but that coincides with the COVID period. In this context, one of the impacts we've seen of COVID on counter-terrorism is the fact that it has led some of the military cooperation actors to go back to their countries, essentially. So actors like the EUTM, for instance, which is the European Union training mission with a mandate to help build the capacities of the military here in Mali, have had to withdraw for a moment. This happened with a number of other forces. And this roll down, of course, has had an impact on the operational capacity on forces on the ground. At the same time, this, I think, could be seen as a challenge as well as an opportunity. There has been a discussion on the table for a long time in the Sahel about the need to de-zoom from the counter-terrorism focus and to expand the tools that we use to fight insecurity in order to better include protection of civilians. And this, I think, is an opportunity we have. Civilians are the most affected by COVID, as well as by communal violence, as well as by the geographic expansion of violent extremist groups. So this is our chance maybe to rethink, based on the tools that we now have on the ground, what we can do to improve the protection of civilians. This in turn will likely deliver counter-terrorism and counter-violent extremism outcomes, in the sense that populations that feel less exposed, that are better protected, are also less likely to join groups. What ISS research, one of the things that ISS research in the Sahel clearly demonstrates is that self-protection, or the will to protect your family or your livelihood, are at the top of reasons that push people into joining these groups. We hear a lot that people join because of a lack of employment. What our research shows actually is that generally, people tend to join because they want to protect existing livelihood, not because they don't have any. So these, I think, are some of the points we should keep in mind, and maybe I will keep it to that for now. Thank you.
Thank you very much, Ornella. It's been fascinating. One of the biggest advantages of the GRN, the way we see it, and Dave elaborated on this, is that it allows all of us who are online here, but for us, most importantly, the Security Council Counter-Terrorism Committee, to get access to trends that are now beyond the horizon, that people are not actually seeing them, but by researchers like you that are able to de-zoom, or able to give us the conversation in the right direction. And you said a few things which are extremely important to the conversation on violent extremism globally. 6 million people pushed under extreme poverty line is not good news for anything, but it's bad news for anyone who understands counterterrorism and the links that also Raffaello mentioned between inequality, poverty, frustration, boredom, unemployment, and the way the terrorist organizations are so easily manipulating them in order to get new recruits. So we're having here a new mix, and in Africa that is becoming more and more digital. The ingredients for a wave of violent extremism perhaps are planting today, and this is a very important message that I hope will come out of this discussion to the many policymakers who are listening to us. We in continuing our global tour, we will jump immediately from Africa to Central Asia, and we are very delighted to have here Yulia Denisenko, who is the director of the Asia Group Foundation, another important member of the GRN. Thank you, Yulia, for being with us. Yulia has 15 years of experience in the fields of CVE and de-radicalization in Central Asia. She has been focusing on the rehabilitation and reintegration of family members of foreign terrorist fighters. We also have with us Nurlan Abidayev, who is a legal expert at the Asia Group Foundation. Nurlan here wears two hats. One of them is that without interpretation capabilities in the Zoom platform, we will hear Yulia's speech in English via Nurlan, and I apologize, Yulia, for not being able to offer interpretation services for this event. But Yulia will then participate in the conversation either directly or through Nurlan. So over to you, Nurlan and Yulia. Thank you so much for being with us, and we really look forward to hearing your thoughts.
Thank you too.
Thank you very much, sir. Good morning, dear participants. On behalf of the Public Fund of Asia Group, which is based in Kyrgyzstan, I would like to thank all of you for the invitation to the forum. It is a very big honor for us to participate and share our experience and gather other useful experiences from different professionals. I will try to use my time very effectively. Therefore, several things I want to mention at once. So firstly, of course, we are absolutely agree with our previous speakers. The COVID-19 pandemic time is very affected and has impacted for our discussed topic. And in this framework, we would like to draw your attention for rehabilitation and repatriation process. If you know, Central Asia nowadays is a leader of the number of returned citizens from the war zones in Syria and Iraq. Almost 900 people was repatriated. The most amount the repatriators are children and women. However, there are several amount of men. So all of them nowadays have got the chance to start a peaceful life. And in this situation, we need to act quickly and almost blindly and random, because as we know, there is no effective rehabilitation program that has been proven in the world. Unfortunately, this is a fact. So if we take the wrong step now, thousands of people could suffer tomorrow. In our program, like most our colleagues abroad, we focus on primary profiling and the study of personal risk factors. But here I must admit this is not enough. If if out of 10 clients, one, if will return down the ideas of violent extremism, it will be already achievement. But even those who have passed an excellent course on rehabilitation can fail. For instance, we can consider the recent situation which happened in Vienna. That's why we need to act now by carefully search and consider the problem. In our opinion, we have to change strategy and try to create the new algorithms for rehabilitation. During our regular work, we have identified two more categories for risk. They are systematic and organizational. We are currently determining how system fails can affect the transition to the light side. In this framework, I would like to give a couple of examples, which has really happened in the practice. Two grandchildren were returned to the grandmother. One is an 8-year-old boy and 1-year-old girl. So their mom and dad had been killed in the war. The middle boy died on his way to the camp. The older brother had the 3-year-old boy with one hand, and with the other he hugged his nursing sister. But in the crowd, children's hands lost each other. The kid was simply tramped in front of his older brother. After being of a month of quarantine, the boy was repatriated home. So now the boy constantly cries and blames himself for the death of his brother. Grandmother also cannot help because she is in a state of self-depression. She was not ready for such kind of grief. Another example, the relatives of returned niece wanted to give her for the marriage without taking her to secondary school. In this case, both parties weren't ready psychologically to reintegration. Indeed, there was a lot of problem. So to sum up my speech, I would like to draw your attention to a very important moment of discussion topic. In our opinion, rehabilitation process should begin before the peacekeeping operation. It means organizing process with the family, training of relatives as a members of rehabilitation team. Of course, there are other risks, but this is the most important one. And so far, it is end of my speech, and thank you for your attention. We will be happy to answer for any question if you have. And I will try to address your question to Yulia, and she will answer more professionally. Thank you.
Thank you very much, Nolan, and thank you so much, Yulia. You touch on one of the critical areas of policy discussion today at the UN, which is the issue of rehabilitation, reintegration, possible repatriation. This is a huge challenge for member states, and we know two things. We first know that Central Asia has an enormous amount of experience in this area. Therefore, the work of researchers who are able to look at what policymakers are doing and give all of us an independent research that says this works well, this doesn't work well, is of an extremely important value. Which brings me to a question that I would like to pose first to all three of you. For us, one of the biggest advantages of the Global Research Network is not just by the research itself, but no less importantly, by being able to connect research to policy making. And if I want to, if I am taking for a minute carrying for a minute the head of a policymaker who listens to our conversation, probably the question that he or she is asking himself that right now is, how does that impact my policy? If I'm now sitting in a discussion in the Security Council, in the General Assembly, in a regional organization, or in a government, all your insights, and I want to go with all of you with the same question, basically, and I hope we will have another round, but if not, I think that will be enough to justify the panel. If you were to give one policy advice to policymakers around the world based on your own research, what would that be? And perhaps we would start with you, Nolan and Julia. You've been patient to listen to the others, so I want to start with you. Central Asia has enormous experience with repatriation, with reintegration, with rehabilitation. If you were to give one policy advice to policymakers who listen to us, what would that be?
Thank you. So I would like to address this question, Юля. Юля, пожалуйста, дайте пример, как может правительственные меры оказать воздействие на данный процесс и конкретный совет для мировых политиков решить этот данный вопрос, потому что Центральная Азия имеет один из хороших опытов для решения данного вопроса.
Спасибо за вопрос, Дэвид. Я постараюсь очень кратко, тезисно на него ответить. Во-первых, если сейчас страны не будут решать этот вопрос, то его придется решать гораздо позже, может быть, через несколько лет, когда эти дети, которых мы фактически сейчас бросаем там, в зоне военных действий, вырастут и придут на родину уже другими неофициальными путями. Тогда проблем будет намного больше. Сегодня мне хочется верить, что ни одна страна не способна бросить на произвол судьбы своих граждан, в том числе маленьких детей, которые ни в чем не виноваты. Я думаю, это самый сильный тезис, который может мотивировать, с одной стороны, такую моральную сторону государства, а с другой стороны, это действительно угроза безопасности, которая в будущем может вырасти в несколько сот раз, несколькократно, да. Примером прекрасного взаимодействия. Да.
And I'm just conscious of the time. We have very tight deadline, so please go ahead.
Yes.
Okay. So, thank you very much for your very interesting and important question, Mr. Scharia. As one of professional expert in this area, I would like to say any kind of government policy should be regarded this kind of problem, because we have to act. We cannot leave it, and if we will not do anything, our citizens, especially children, will grow up there and they will mostly affected by bad ideas to fight, and they will return. Anyway, they will return. So that's why we have to act and create most important plan how to do, and share our experience how to prepare the algorithms for reintegration.
Thank you. Thank you very much. These are very, very important messages. Anyone who thinks that the problems of in the refugee camps or elsewhere will solve itself is grossly putting all of us at risk of getting it wrong. And I think that's an important message that we will be happy to carry with us. And the other one that you mentioned, that we need to continuously learn from each other. We've seen recent attacks in Vienna and in France, and that shows that we have a whole lot of experience to learn on rehabilitation, on de-radicalization, and none of us has yet found the magic formula to solve it. I apologize for not giving you more time, because I really wanted to go to Ornella and Rafaela to give them the opportunity. So Ornella, the same question to you from your perspective, from what you're seeing in Africa. What would be one message that you want policymakers listening to us to take with them?
Okay, so if you allow me, I'll make it 3 main takeaways, but I'll keep it very short. The first one, in terms of policy recommendations, is we need to decompartmentalize areas. In the Sahel, we've been treating the humanitarian crisis separately from the security crisis, separately from the governance crisis. This isn't working, and it's leading to a situation where, you know, things are so interlinked that we keep missing opportunities. So that's number one, decompartmentalize. The second one is, as I mentioned during my earlier intervention, prioritize protection of civilians. A CT-focused agenda only will not and cannot deliver security in the Sahel. And so the approach, the vision needs to be broader. It needs to include some level of CVE and CT, of course, but it also needs everything that goes with it to make sure that we have a broader protection of civilians approach. And the third one is we need to invest in structural prevention of violent extremism. And what I mean by structural prevention is not just wait for risks of specific communities or people joining the groups to come up and then rush in with development projects or such incentives. We need to take things in a much broader and societal way, which means addressing the factors behind individuals and communities' resilience. This is the reason why I mentioned poverty. This is the reason why we should also be looking at things like land management issues. So again, we need to take a governance-focused approach.
Thank you very much, Ornella. My job is to make the life of all of you hard, and I'm gonna pose immediate follow-up question to this. This is a time of constraints, and we all mentioned it, that one of the changes we're going to see is less government resources being allocated to deal with the structural issues that you highlighted as key ingredients to reducing the level of violent extremism in Africa. With government resources are so stretched, how do you see governments in Africa reacting with very limited resources to issues like the ones you mentioned, dedicating resources to PVE, to inequality and poverty? Very quickly, because I really want to get Rafaela too before our time is ended.
The resources are limited, but actually it may not be so much about how much we invest as about how we invest it. So it's not a matter of increasing resources necessarily, although that would be welcome, but it's mainly a matter of making sure that we're making smarter choices about where we're putting our resources. And a very good example for that, in just 1 minute or even less, is Burkina Faso, where we have seen an increase, a big increase of hard security expenses within national budget over the last few years, but this has not delivered the required return on peace and security. At the same time, we have seen a school crisis that made things worse. We have seen the COVID crisis that made things worse. And now we have in Burkina Faso a country that has over 1 million IDPs, for instance. Again, it's a matter of where we decide to invest, what the little we have.
Thank you so much. And now back to you, Rafaela. We started with you. Probably end with you. And if there is one takeaway from this conversation or from your research touches on terrorism, but also on counter-terrorism and the impact of COVID-19 on both. What would be the one takeaway that you want policymakers to take from your research?
I mean, it's you're asking an incredibly difficult question, of course, because of course to research everything is incredibly important. You can't distill it down, but to try to distill it down to one issue in particular. I know, and it's great. I appreciate you kept us all on track. But I think to sort of drill it down and to focus in particular on Southeast Asia and South Asia, where I'm based at the moment, where I've been doing work at the moment and researchers I've been interacting with out here. In some ways, it echoes what Ornella was just talking about. But I would say the big issue I would say that people here maybe aren't totally focused on and probably should focus a bit more on is community tensions, and community tensions that are being made worse in the wake of COVID. And you can see this in all sorts of different spaces. In terms of political parties who are sort of, already have a habit of sort of fueling tensions as part of their kind of political rhetoric. That's been made infinitely worse during this period. You've seen instances where communities have been blamed for problems. In some countries in South Asia in particular, we've seen instances where, Muslim communities have been blamed for the problem, and so they suddenly become then the sort of bigger community tensions that are generated from that, which ultimately will steer people towards violent extremism, are being exacerbated as people react to COVID. So I think community tensions is something that in Southeast Asia and South Asia in particular has been, a problem for a while, and it's a problem we all know about. But I think it's something that's getting slightly worse. And I think with the kind of shift in attention, both in foreign governments, but also in local governments towards looking towards healthcare, or towards not really paying attention to these issues that anyway, they're always a bit questioning about whether they should be worrying about them so much. That I think is going to be something which is going to sow seeds, which frankly are going to produce problems sometime in the near future. So I would say community tensions within a kind of South and Southeast Asian context is something that I think policymakers should really be paying attention to, because they are getting worse. And I think they're going to be getting worse as a result of the fallout from COVID. And that's where future problems may emerge.
I think you touched on a topic that we haven't discussed enough. After all, we had only 45 minutes for this, but we could have dedicated a whole session to this issue of how COVID-19 impacts communities around the world. And not being shy of self-promotion, I would say that CTED produced 2 excellent reports by Dave and his team on the impact of COVID-19 on a specific ideology, the extreme right wing, or it has other terminology that is being used. And we have seen exactly that in times of pandemic, immediately all demons come back to new and get new life. And you could see that in all over the world, wherever, if it's in a Muslim community in India, as you mentioned, or it could be Jews or Asian Americans in the US, and all over suddenly, those demons are coming back and old myths are getting a new life. This is a very, very risky direction that pandemics such as COVID-19 can lead communities. And Julia, on her side, also highlighted the importance of community when you speak about rehabilitation and reintegration. You cannot do it outside the context of a healthy community that is willing to absorb back young people who went to Syria, Iraq, or elsewhere, and now need back the community. So if the message of our community is extremely relevant to the context of violent extremism, CVE, certainly PVE that you, Ornella, mentioned, and in general, we encourage, and the Security Council encourages member states to take a whole of society approach. And we've seen that in every part of the world, in different parts of the world, the role of community is extremely important to making sure that people are not radicalized, or when radicalized, can be brought back into the community. I think our time has ended, and I want to give back the microphone to our friends at the Soufan Center with another opportunity to first thank all 3 of you Raffaello, Ornella, Julia, and Nolan. Thank you also. Thank you, Dave, and his team for doing such great work on promoting the GRN. And all of you who are interested in becoming part of the GRN, please reach out to us. We want to make it a truly global network. Back to you to the Sufan Center, and thank you all for being with us. It's been a great panel. Thank you.